All right. And if a parent is listening to our show here, the Dare to Dream show today, and they have suspicions that they have a young child who may be having some learning difficulties, what are some of the warning signs? I know we said that learning disabilities affect different children different ways, but then again, there are certain signs, certain indications that a lot of times indicate that there is a learning disability problem.
Absolutely. And go with your gut instinct is the first thing I have to say. If you're concerned at all, make sure you don't stop until you get a definitive answer, because so often parents go to their pediatricians and they're told, oh, he's a boy, he's a slow learner, he's a late talker, he'll grow out of it. Absolutely don't ever accept that as an answer. But if they really want to look, we're starting to be able to identify these children as early as 15 to 18 months now. Some of these disorders, however, don't show up until a child enters elementary school age. The disorders that we call ADHD and bipolar or dyslexia, really we can't identify those until they're in a more of an academic environment. But if you have a child who has difficulty communicating their basic needs or wants, and I'm not talking about just asking for things verbally, but even using gestures, being able to point at things to make choices. A child who avoids eye contact, a child who's having difficulty making friends, a child who seems to be irritated by things in their environment, whether it's lights or sounds. Vacuum cleaners tend to really be a variable that triggers a lot of anxiety in children. If they can't stand the tags in their shirts. I know Hanes just came out with their tagless shirts, and a lot of us fall into that category. But we're looking at how extreme these challenges are impacting the child's ability to fit into everyday life. If they're not responding to their name, if they have difficulty with their academic work. Children don't go into school wanting to be poor learners. So that's really an indicator that something else might be going on that we need to look into.
All right. And let's talk, I don't want to put you on the spot, but let's talk about medication. Because it seems like, and I don't want to generalize, but it seems like a lot of times when you go to talk to someone, a specialist who maybe specializes in children with learning disabilities, the very first thing they want to talk about is medication. Is that always the answer? And is it an answer in addition to modification of behavior?
Nothing is ever always an answer. I think medication can help for certain children with certain challenges, but it can't be relied on solely as the source of treatment. It really needs to be combined with a behavioral program, and the medication should really be utilized to to lessen the behavioral challenges so that we can get better control environmentally, whether it be through changing teaching strategies or changing the way we respond to certain behaviors. We can tend to manage that. But there are some children who will need that. But again, it's never a source that solely should be used.
And what are some of the great things that parents can do to change their behavior, modify their behavior, and change the way they react to a lot of times the things that children do when they suffer from learning disabilities seem to be irrational. They seem to be just being difficult. You would think, they're just being hard to get along with, they're just being hard to please. So what can parents do to change the way they react to that, to help the child?
The best thing they can do is learn and find support, because there's no manual out there. Nobody has the perfect answer for you. So if you can get exposure to different treatment strategies and different ways of responding, and then get support knowing that you're not the only one that's experiencing these irrational beings who have shown up in your home. We have conferences, educational conferences that we do once a year. We bring in experts from outside of the area, but we also bring in a good group of local experts who are here to coach parents on different strategies and techniques. Our conference coming up this year is October 2nd, Transition Advocacy and Self-Advocacy Summit. We're going to be working not only with parents and educators, but also with the individuals with disabilities themselves, so they can learn how to have their voices heard.
And if you are just joining the program, this is Dare to Dream. We are a program about the Unicorn Children's Foundation, a local group here in South Florida, and they are working and doing a lot of great work for parents and children who are suffering from learning disabilities. And let's not forget the parents need a helping hand. And as you mentioned, read and get as much information, arm yourself with knowledge. And a lot of that information can be found on the website, Unicorn Children's Foundation. Tell us a little bit about the website and what some things that folks can find on there.
Well, here's some exciting news. We are actually in the process of relaunching our website. It will be relaunched by the end of the month. One of the things that's going to be exciting is we're going to add a lot of e-learning opportunities where we will have webinars available for parents. Currently on the site, we have checklists and questionnaires, list of warning signs that they can utilize. But again, that's just one resource we have available. We have a resource library within our office. We have a child development specialist on staff who is there free of charge to the family that can provide consultation on what resources are available in the community, and as well as, discuss with the parents how their current treatment strategies are working.
And where is the center located?
We are in Boca Raton, off of Boca Raton Boulevard, just south of Yamato.
All right, so pretty conveniently located. You mentioned earlier in the show today, the Dare to Dream show, about the parent roadmap. And on that website page, the contents of the roadmap, where to go if you suspect a problem, and choosing a professional. Boy, that's worth the price of admission right there. Choosing a professional. This is something that's not very easy for parents because there are a lot of people who are more than willing to try to provide information. But how do you know the professional you choose is the right one for you?
Well, we actually have a questionnaire on there that looks at evaluations and what needs to happen during the evaluation process. And any professional who's going to work with your child really needs to conduct a thorough multidisciplinary evaluation so we know what the child's strengths are and what the child's weaknesses are, because we can work on their weaknesses by utilizing their strengths. So we need a strength-based program. We need one that includes parental involvement, because guess what? After that hour with a professional, 23 hours, they're back at home with the parents. So we really need to have parental involvement, parental training and coaching. We've got a lot of different variables that we help parents in evaluating their professionals. We're hoping to launch an alliance of organizations where we have a one-stop target on our website where they can look at different professionals in the different fields, because right now there isn't anything like that exists out in the country or even locally. We've got sporadic professionals providing services, and parents are really left to their own devices to find out which professional works best for them. And
there's also a page on the website at unicornchildrensfoundation.org for professionals, and I think that's great, because I think as we touched on a little bit, sometimes professionals aren't really well versed, it's hard as it may be to believe, they're not really well versed in dealing with children with learning disabilities, and sometimes that may lead to a tendency to just want to lean on medication. So tell us a little bit about what resources there are for professionals. We may have some professionals out there listening that want to get a little more involved in that aspect. So what resources do you have for them?
Absolutely. What we're finding is in this field, it takes about 20 years from information to get from the laboratory, the research laboratory, into the applied settings. So we've got a 20-year gap, and we're trying to foster bridging that gap by getting the information to the practitioners more quickly. We've got a research program up at York University in Toronto that's comparing different intervention techniques. It's getting ready to roll out into the publications, but we want to be able to educate the educators out in the field now instead of waiting for them to find it. So we're trying to facilitate that transition. We also, through our educational conferences, have different techniques and strategies that we work with the teachers, and we hope to educate our leaders, because the leaders in the community really need to step it up. Harvard did their School of Public Health did a research study, a cost analysis, and they figured for one individual who was diagnosed with autism, it would cost $3.2 million to take care of that person over their lifetime. Now, if we can put the dollars in, front load the dollars into interventions, we may not need as much support, and it actually would be more cost effective. So not only do we need to educate our parents to be informed consumers, we need to educate the educators to make sure that they've got the right supports and techniques in the classrooms, and the interventionists are using the most updated best practice strategies. We also need to make sure our community leaders are stepping up and providing